Dr. Allison Arwady from the Chicago Department of Public Health is joining us live now. Thank you, doctor. And you say the data shows it's safer for kids in the classroom instead of outside, but we do see how fast it's spreading, the massive surge in cases in our city. How do you ease teachers' concerns about being in these classrooms and make them feel any safer?
So we are definitely in a big surge of COVID, no question about it. What we've seen, though, over and over again in data is that where you've got the mitigation measures in place and you're taking COVID seriously, the spread is lower. And I can tell you my team has been working very hard all day to support CPS in terms of trying to build some additional testing capacity, if that will help ease people's concerns. We've been working on making sure, and there's testing going on even while the schools are not open. There's vaccination going on, and the work to really get us back is absolutely my top priority.
Yesterday, we remember you mentioned the city is out of rapid tests and you were encouraging people to buy them on Amazon, but that is expensive and certainly not doable for everyone.
That's exactly right. And that's been really one of our biggest frustrations. There is a move to, as people have probably heard, centralize this at the national level. I actually think that makes sense on some level because it means you can invoke the Defense Production Act. You can really get this going. And I was on the phone with federal leadership and, they're saying within a couple of weeks, this should be available where you can order online or call and there will be free test rapid available. But ramping that up, 500 million tests at the first go has meant that the supply chain has really dried up. And so, I personally, I make sure that the things that I say, I also try to do, and I know how hard it's been to get rapid tests. So I did order some for myself online, but I know that's not open to everybody. We have been working every way we know how in terms of anybody who has any potential testing available. I want to have people have the access to the tests they need, and we want to return to distributing them in the areas of highest need, which was what we were doing before. And we want to make sure that these tests are available in the schools because that will help ease, I think, people's concerns.
Yeah. If we go back to the numbers, a record number of cases now in Illinois today. Chicago's positivity rate, 23.3%. When do you see the surge subsiding?
That is the million-dollar question. If we knew this surge was over tomorrow, this would be an easy decision. The problem is that we've not yet seen it subside in, for example, Europe or the UK, which were a little bit behind South Africa in terms of seeing that initial surge. We've seen no sign of it cresting yet in New York City, which has a positivity more than 10% higher than we do. And I am confident based on what our modelers are saying, where we look at the data, 80, 90%, I think it's going to peak in January. Just the question is that going to be early in the next week or two, or might it be a little later near the end of the month? But if we've learned nothing, it's to be humble when we are trying to make predictions around COVID and the way it may continue to evolve. That's why I feel strongly about having the safety things in place and having schools in person, because at some level here, we're going to be living with COVID. And if we can protect against severe outcomes, I do feel strongly that it's an essential service for society, and doing everything we can to make people feel confident in the safety measures in place, I think is critical.
All right. Well, Dr. Arwady, we know you, the mayor, and CPS CEO Pedro, he will be a part of this press conference. It's coming up in about 30 minutes. We will anxiously be awaiting to hear what you can say to us then about what will be announced. So thank you for joining us.
Thank you. And can I just say, for parents, I know it's so stressful. If you are out of work, you're out of school, try to take a minute, make that vaccine appointment for your child, get anybody in your home boosted. That's something you can do right now today to help us get kids back in school. Thanks.
All right. Dr. Arwady, thank you.